What's the number of working parts in the human eye? The answer is C. With over 2 million working parts, the human eye contributes to 85% of the knowledge we obtain over our lifetimes. If you are over the age of 40, you probably have noticed near objects are beginning to appear fuzzy and out of focus. You may be experiencing a condition called presbyopia, which happens to all of us at some time in our 40s or 50s. Dr. Diana Kirsten of Harvard Eye Associates speaks with us about a new development in implant technology. Just on the horizon, this implant, called the autofocus corneal inlay, could bring new hope to millions of people who'd like to gain independence from their reading glasses.
We're going to talk about the new camera corneal inlay lens that is not quite yet FDA approved, but will be fairly soon. And it is a new way for patients to be able to read without reading glasses. It's a totally new idea. All these corneal inlays are new in the United States. Basically, it takes a small lens and a LASIK flap is created, a LASIK type flap is created. And then under the flap, this small lens is placed right into the center of the pupil. And then the flap is laid back down, thereby keeping that lens right in the middle of the pupil. And the lens has a small aperture, so it increases the depth of focus of the eye and allows this eye to see distance and close-up. Previously, attempts to allow people to see distance and near were mainly focused on giving patients monovision, that is, one eye that sees well in the distance and one eye that sees well at near. But that close-up eye would thereby have blurry distance vision. So this is the first thing that's available that will allow one eye to see well up close, but also maintain good distance vision and therefore good depth perception, good driving vision.
When will this new technology be available to patients in the U.S.?
They're called AcuFocus. They're very well thought of. The lens is being used in Europe and all over the world. Our FDA, being very conservative, has been evaluating it, but I'm quite sure that they will be approving it in the near future. The great thing about this corneal inlay design is that you can have it if you're just a normal person who has good distance vision, but now that you're over 45, you have to wear reading glasses. So there's millions of people like that in America. You could also be someone who wants to have LASIK, and as part of your LASIK, you can have your distance vision corrected and then this camera inlay put on your non-dominant eye. The procedure only takes about 10 minutes. It's actually a bit quicker than LASIK. The flap is made with the same technology that's been used for years. It's a femtosecond laser flap, just like any LASIK flap. This flap is lifted, and then this very, very thin, small corneal inlay is placed, and then the flap is brought back down. Literally, it takes less than 10 minutes. It has a lot of advantages in that it can be removed, and therefore it's a totally reversible procedure. So if a better product came along, or if you needed cataract surgery, the inlay can be removed and your eye is pristine. It's as if nothing was ever done. The design of the corneal inlay is that it's a 3.8 millimeter ring. And when it's centered on your pupil, generally it'll just look like part of your pupil. It has a central aperture that's 1.6 millimeters, and that is the pinhole effect. The pinhole effect's been used by eye doctors for hundreds and hundreds of years, and the principle is that if you look through a very small aperture, your vision becomes sharper. And it's an optical effect, actually, in that the peripheral rays of light that would blur the image are blocked out, and only the rays of light that go straight through the eye are allowed to come in, and these are perfectly focused on the back of the eye. Just like with a camera, a smaller aperture gives a better depth of field. And once this implant is placed centrally in the pupil, you have good near vision, but you haven't lost your depth perception or your distance vision. It's the very first corneal implant that will be FDA approved. We've had implants for cataract surgery and implants for correcting nearsightedness, the intraocular contact lens. But this is the first implant that actually gets placed within the cornea in order to improve your depth of focus and your near vision. It's going to be an amazing innovation. I think when it is FDA approved, everyone will hear about it. I think we haven't really had a great option for presbyopia, or the whole reading glasses problem that we all have one day. And I think this will probably be the best option available for millions of people.
Next up, eye problems that can lead to blindness if not treated.